Good afternoon, everybody. This is Bonnie Vandermeulen, Training Coordinator for Wisconsin Facets. On behalf of our entire Wisconsin Facets staff, I'd like to thank you for joining us today. Our webinar today is Wisconsin Children and Youth with Special Healthcare Needs, Supporting Families and Providers Who Support Them. Our presenter for today is Becky Burns. Becky Burns' career centers on supporting children and families whose lives have been affected by unanticipated journeys through the world of disability services. She treasures the opportunity to work with these families whose resilience and growth continues to astound her. With a Master's of Science in Social Work, she has used her education along with her personal experience of being raised in a family with a child who has a disability to influence her work with families. She has worked in one capacity or another for the state of Wisconsin for over 20 years. It is my sincere pleasure today to introduce to you Becky Burns. Becky?
Well, thank you so very much. And I appreciate this opportunity to share our information with your listeners. I'll let you know right out of the gate that the GoToWebinar is such that my camera is here, but my notes are over here. So if I don't seem to be looking to you directly, it's because I'm reading off of my notes to make sure I cover everything today. So to begin with, the Children and Youth with Special Healthcare Needs Network is really a network of a variety of programs. And we receive our financial support from the Title V program, the Maternal and Child Services Block Grant, and I serve as the statewide coordinator for our program. So a little bit about me as we begin to get today. As mentioned, I come to this work from the experience of having a sister with significant disabilities. Of course, my experience is a bit dated as my sister is now nearing her 60th birthday. I should note I am her younger sister. But I still have the passion as a family member who knows what it's like to love, care, and raise someone who has disabilities. I now serve as her guardian and truly dread making the end-of-life decisions for her someday. But since I was a teenager, I started working with or on behalf of people with disabilities and have now spent, as mentioned, over the last 20+ years in state service and the past 5 years with the Children and Youth with Special Healthcare Needs program. All of our network programs focus one way or another on the healthcare system and share these 5 guiding principles. Children are best served within their families. Children, youth, and families are best supported within the context of their community. Families will have convenient access to care planning. Collaboration is the best way to provide comprehensive services. And finally, the family perspective and presence must be included in all aspects of the system. And who are the children and youth with special healthcare needs? In Wisconsin, we use the federal definition of children who have or are at increased risk for a chronic physical, developmental, behavioral, or emotional condition, and who also require health and related services of a type or amount beyond that required by children generally. With that definition in mind, we end up talking about 1 in 5 children have a special healthcare need, or roughly 20%. This might be a developmental disability like autism spectrum disorder, Down syndrome, or cerebral palsy. It might be a child with a physical condition like spinal muscular atrophy, diabetes, or asthma. It includes children who have behavioral or emotional conditions like depression, anxiety, or an eating disorder. So as you can see, we aim to serve and support a wide range of children and their families. So here's our network of programs that we support. I'm going to review each one in more detail in a moment, but as a way of introduction, we're going to start in your upper right-hand corner where you see that map. And that map represents our 5 regional centers that provide support directly to families and to the providers who support them by offering information and referral services. Going clockwise around our circle, the next we have the Well Badger Resource Center. They too provide information and referral support to families and providers. The difference between the regional centers and the Well Badger Resource Center is that the regional centers focus on their specific region, whereas Well Badger provides support across the entire state and to a wider variety of populations. Next in our circle is the Youth Health Transition Initiative, which is one of our hubs of expertise. They are staffed by parent professionals who support the process of transferring from pediatric care to the adult healthcare system. Next is ABC for Health, which is, in short, a nonprofit public interest law firm that's available to help families with their insurance and other medical benefits. Next, similar to our Youth Health Transition Initiative, our Medical Home Initiative is another hub of expertise. This one supports the efforts of ensuring that every child has a medical home, that is a medical team of supports that are meeting the child's needs. Next, Parent to Parent Wisconsin is our state's parent matching program, where they can connect a family who wants to talk to another family who's gone through the experiences that they're facing for a little bit of peer support. And finally, Family Voices of Wisconsin. Family Voices is our state family-to-family health information center, where they're staffed by parent professionals who help explain the complex systems in plain language and help train families to be stronger advocates in their child's lives. So we're going to begin again with our regional centers. There are 5 centers located in the 5 public health regions of the state. As I mentioned, they are staffed by parent professionals who are there to answer the questions, whether you're a parent or a provider of children with special health care needs. So take a moment now and write down the phone number for your region and get ready to give them a call. I should mention that when I talk about parent professionals, I'm referring to people who are either parents or siblings of children with special health care needs, which represents most of our staff, or people who have lived experience of having a disability themselves, or professionals who have degrees in the field of supporting families of children with special health care needs or disabilities. Our regional center programs are housed in larger entities. 2 of our centers are housed within local public health departments. 2 are within the Children's Wisconsin's medical system, and 1 is located at the Weissman Center in Madison. Regardless of where they are, they all offer the same support and services to families and providers. They do most of their work through the phone contacts and emails, but they are also the program that provides training for families in our network. And I'll share some of our training programs a little bit later in this presentation. I want to share some of the themes that we've heard from our regional center staff. Our work is diving in, being with, walking along the side of parents. I think this speaks to the relationship between the regional centers and families. They're there for support, letting families determine the path they want to take. We often see their professional role to be that of a Sherpa, helping guide the way on a path that others have traveled many times, but this may be the first time for this new traveler. And every journey is unique, but it is often helpful to have someone along with you as you find your way. Next, we spend as much time as needed, as often as needed, and as long as needed. This statement really reflects the duration of the relationship and how, again, it's driven by the parents. Many parents call once and then years later may reach out again. When their child goes through another transition or has a change in schools or a change in doctors, these are some common times that they may reach out to the regional centers. Sometimes a call can be answered in one referral, but most often one referral leads to another idea that a family wants some support with, and then that relationship will continue as long as it takes to address the concerns that a family is facing. So our regional center staff routinely check back in with families a few weeks after providing a referral to see how that process went and to see if there's any other way that we can offer support to that family. And finally, families tell us, you listened, you helped me with what I thought was important, and you helped me find my next step. Often families call not being certain what it is they need. And after chatting with one of the information and referral specialists, they start to learn what they didn't know before and get a lot of information out of that conversation. There is no right or wrong reason to contact a regional center, and every call is unique to that family and that child. Here are some of the reasons families do call the regional centers. Again, I want to stress that many families call about one question and end up getting information about other topics as well. Since the regional centers are not connected to any specific family funding source, families can speak quite freely about anything going on in their child's life without any worry about retribution to their child's supports or services. We like to see the regional centers as a first place to contact if a family isn't sure where to turn. It can be an issue related to school services, waiver services, support services, medical services, what have you. Bottom line, the regional centers are here for you. We offer this chart just to illustrate the number of calls we receive and what happens with those requests. So as you can see, we typically have over 1,000 calls a year from families. And of course, last year took a hit with COVID-19. And from those calls, most of them are seeking basic information, while nearly the same number are seeking a referral to a program or a service. And based on the number of total referrals, you can see that many families get multiple referrals out of a single call. It may also be of interest to you that our regional centers tend to receive about 1,000 calls from providers as well each year, seeking support for their patients or their students. And again, for every referral a regional center makes, they offer a follow-up call to the family to ensure that they were able to connect to the provider that they were seeking. And if they didn't connect, or if they've changed their minds about how they want to pursue the next steps, that's fine. The regional staff are happy to talk about other ideas or offer additional resources. Moving on now to the Youth Health Transition Initiative. As mentioned previously, this is one of our hubs of expertise. They're located at the Weissman Center and provide up-to-date latest information about best practices when it comes to helping youth transition to the adult healthcare services system. They incorporate the 6 core elements of healthcare transition from our national partners at GOT Transition. Sometimes a youth will need to change doctors or insurance providers as they become an adult. But even for those who those two things remain the same, there's still a different experience when receiving care in the adult system rather than the pediatric system. Learning to be as independent as possible, knowing when you'll need help from others is really critical during this transition of care. Although there may be many transitions in a person's life, transitioning from high school to work or higher education, perhaps moving out of the family home, we think that figuring out your healthcare transition is of greatest importance. For people with special healthcare needs, maintaining their optimal health will impact their ability to successfully consider those other transitions into adulthood. You can check out their website to learn more. Soon they're going to be uploading some videos to their website where you'll be able to listen to youth share their experience in making this transition, with the good and the bad experiences unveiled. You might be wondering why we're talking about youth health transition. Well, that's because it's one of our 2 national performance measures and something our funders expect us to improve over time. This chart comes from our most recent data from the National Survey of Children's Health. Wisconsin is represented here in the blue circles as compared to the national averages. And CYSHCN stands for Children and Youth with Special Healthcare Needs. So as you can see, Wisconsin is doing better than the national average, which is a little bit hard to celebrate our success when less than 1/3 of youth with special healthcare needs are having successful transitions, and less than 1/4 of all children are having a positive experience. Clearly, we have room for improvement. So success is measured by asking families if their children between the ages of 12 to 17 have had discussions with their doctors about the following aspects of transition. Have they talked about transferring to doctors who treat adults? Have they talked about changing healthcare needs as a youth becomes an adult? Have they talked about how to maintain health insurance as an adult? And in addition, whether or not their doctor usually or always encourages them to take age-appropriate responsibility for managing their own healthcare. As you can imagine, many of these concepts could be worked on in school or through an IEP. Learning about how to care for your own health is a skill all youth need to learn. We continue to partner with schools to incorporate these lessons into the school days. Our Youth Health Transition Initiative also works directly with clinics to try and standardize this transition process for all youth. Our next hub of expertise is our Medical Home Initiative. It's located at the Children's Health Alliance of Wisconsin. They're busy supporting the components of a medical home. For those unfamiliar with the term medical home, it's not a physical place. Rather, it stands for the relationship and partnership between a child and their primary healthcare team. It includes services such as care coordination, the use of a shared plan of care, and encouraging care mapping for families. And again, just to ensure that we're all on the same page, care coordination is having someone help a family schedule all of their medical visits, especially with specialists and therapists and procedures. It takes a unique person in the medical service system to ensure that a child is receiving all that they need and that everything is working harmoniously. A shared plan of care is a specific document that a doctor and a family can create together. It includes the family's strengths and goals, along with the child's medical information and next steps to achieving those goals. And care mapping is a great process for families to document all of the different supports and services that they need to care for their child. This might include different care providers, schools, daycare, recreation, and the list goes on and on. This then serves as a tool to show others that who are involved in the child's life all of the touch points throughout a child's day. Often others are not aware of all the variety of systems supporting a family and understand that the family may be navigating all those different systems. This year, our Medical Home Initiative started a pilot program in the Milwaukee area that aims to support the communication between clinics and food banks for families who have children with special health care needs, knowing that people who experience food insecurity have a higher percentage of children with special health care needs. The hope is that by bringing these two systems together, they can better identify and meet the needs of these families. Again, a bit of data for our national performance measure about children having a medical home. A reminder that Wisconsin values are illustrated in blue. So similar to youth health transition, Wisconsin is at or above the national average, but we are still not satisfied with our current standings. There's nothing to be proud of when only 42% of children with special health care needs are being provided care through a medical home. The components that are measured in the National Survey of Children's Health include whether a child has a personal doctor or a nurse, if they have usual source of sick care, if the care that they are receiving is family-centered, if they are having any problems getting any needed referrals, and if they receive effective care coordination when needed. So together with our Medical Home Initiative, the entire network of children and youth with special health care needs programs aims to improve the support that children receive through this medical system, to increase the number of families who experience the support of a medical home where they get the medical services their child needs in a family-centered manner, including referrals and care coordination. Our next partner is Family Voices of Wisconsin. They're perhaps best known for their trainings, fact sheets, and their annual Advocacy for Change event. Their mission is to guide families through the overwhelmingly complicated healthcare system so that they can find the services their child needs and the relief they need. They translate complicated healthcare language so that families can understand and find resources to reduce their stress and expenses. They train families to advocate not only for their own children, but to ensure that the voices of other families are heard too. And they educate legislators and policymakers on the priorities and desires of families with disabilities, so they remember the family voice when they're making policy decisions. Check out their website for their fact sheets and videos. Some of the topics of their fact sheets include children's long-term support waiver services, family support groups, a medical home, what should I expect from my doctor, becoming a family leader, finding and funding respite for your child with special needs, finding the right doctor for your child with special needs, hiring direct care workers, Medicaid coverage for diapers and other incontinence supplies, supported decision-making for transition age youth, and the list goes on. Our other family-focused program is Parent to Parent of Wisconsin. This is a peer matching program for parents who have children with special healthcare needs. They connect parents to others who have walked a similar path before them. This might be another parent whose child has a similar diagnosis, or it might be related to a particular surgery or procedure you're having. They can match people on many different features. On their website, you can complete a simple form and they will reach out to you to connect you with another parent. They also are always looking for parents who want to support other parents. There's something very satisfying about helping another family along their path. Support parents are volunteers who will make a few phone calls with another parent to share their story and listen to the stories of others. Parent to Parent offers a support parent training to help onboard new parents who want to help others. Give them a call or check out their website to get connected. ABC for Health is a longtime partner who helps families get and use the healthcare benefits they need. Health insurance and health benefits like Medicaid are ever changing and always confusing. If a family's having a challenge getting the coverage that they need, or some advocacy around some unpaid medical bills, ABC for Health is here to help. Their benefits counselors are skilled at ensuring families are receiving and utilizing the benefits that they're entitled to. Families have enough on their plate, raising children with special healthcare needs or disabilities. Navigating health insurance shouldn't be something that they need to tackle on their own. If you or someone you know is having a challenge with health coverage, I encourage you to give them a call. And finally, Well Badger, our newest partner in our network. Well Badger Resource Center offers an information and referral hotline for all sorts of populations, including families with children who have special healthcare needs. Their information is on a statewide level rather than the local support that people can receive from the regional centers. One of Well Badger's greatest supports for families is their online database about resources for children and youth with special healthcare needs. Sometimes parents would rather search a database on their own instead of talking to a specialist on the phone. The database is updated and maintained regularly. Currently, it includes over 4,000 services, programs, and resources across our state. It's a searchable database where you can type in your location and see what's available. And you can refine your search by a service name or a health topic. And if you get stuck, they have a chat feature available for immediate support. As I'm starting to already near the end of my time with you today, I want to mention our training opportunities. Our trainings can always be arranged by contacting a regional center. We offer several trainings on youth health transition, including Build Your Bridge, moving from child to adult healthcare. And this is for families and children who will be actively involved in their transition. They review 8 tools of transition so a family can start preparing for this transition early. Dreaming Differently is for planning the transition for youth with medical complexity and/or intellectual developmental disabilities. So similar to Build Your Bridge, it offers tools for transition, but also includes topics such as guardianship and other options to support youth who will need assistance throughout this transition. Bridging the Gap is for communities of professionals who work with families. The content might be targeted for particular groups like school nurses or middle school teachers or transition partners and transition planners in the high school, for example. It reviews the healthcare transition process and how everyone can help kids prepare for this transition. Closing the Gap is for medical providers, and it's presented by one of our medical providers on the Youth Health Initiative team. She talks with other providers about helping youth with the transition process. And finally, What's After High School is offered in collaboration with Family Voices of Wisconsin and provides an overview of the many transitions that take place as youth leave their high school programming. And here's a listing of our medical home training opportunities. Again, these can be accessed through the regional centers. Did You Know Now You Know is a high-level overview of things like Medicaid, CLTS waivers, and other children's services programs. The Care Medical Home Series for families is new since 2020 and offers 4 shorter trainings on specific topics, such as caring for the whole family, which helps newer families explore the entrance into the world of disability services. It reviews the new landscape of raising a child with a special healthcare need and prepares new families for this journey. Assembling a care notebook, which helps families create their own notebook. A care notebook is a filing system for families to keep track of all the medical information about their child and have the information handy for others who may provide care for their children. Requesting a shared plan of care. This one reviews the values of a shared plan of care with your child's primary medical provider and helps families ask for their doctor to create a shared plan of care together. And the fourth training topic is exploring care mapping, which provides the opportunities for families to create their own care map. And finally, Medicaid Made Easy is also relatively new, is provided by Family Voices of Wisconsin. It reviews Medicaid basics for families. For all too often, families get a Medicaid card or a forward card and don't know what it covers. This training answers those questions. Of course, I want to take a moment and acknowledge our funding partners in the Maternal and Child Health Title V Services Block Grant. And finally, this is my contact information. If you have any additional questions, you're welcome to reach out to me at any time.
Okay, Becky, we do have a couple of questions here that just came in. One is, my 15-year-old has 4 moderate to mild health issues and is currently pretty healthy. There are so many organizations, it's overwhelming. Where would you recommend that we start? We live in Dane County.
You bet. Great question. I'm so glad you asked it. So although I mentioned a whole lot of programs that are part of our Children and Youth with Special Healthcare Needs Network, the place to always start is our regional centers. So there's a regional center at the Wasteman Center that's there to answer your questions. And if they feel from talking with you about your child that support from one of our other network partners would be of benefit for you, they'll make sure to connect you with them.
Okay, and I guess this other question is very similar, but what happens if you think that you fall into several different categories? Should we also start then with the regional center, or, you know, call the overarching group like Well Badger?
Oh, great question. Yeah. If you already know that you have a child with a special healthcare need, the best place to start is the regional centers. If you're talking to the regional center and they identify some other issues for your family, maybe housing insecurity or food insecurity or other types of needs, they'll make sure to connect you to Well Badger. But if you already know that you have a child with a special healthcare needs and have some questions, the regional centers are the first place to start. They're going to be the most knowledgeable about services and supports right there within the area that you live, and be able to connect you to all of the other programs that are available for your family.
And one final question that I have right now is, are everyone's services in each of these different divisions free of charge?
You bet they are. Yep, that's one of the really nice things about all of our programs is they're funded by the maternal and child health programs. So there's no cost to any family or provider for accessing our services or supports. So that should never be an issue for anybody wanting some support and some help transversing this network of services and supports.
Okay, thank you. That's the last question. Unless there's a listener that wants to try and get one in real quick, I'll just ask Becky if you have any closing thoughts.
You know, I think you've just nailed it. You know, the regional centers are there to help. They are really our frontline support for families and providers. So, and they just are really receptive to hearing from folks. So never hesitate to give them a call. There is no dumb question. And even if you're not sure what you're looking for, but you're struggling with something, you're not sure where to turn, give those regional center staff a call and they're going to be happy to help you along your way.
Okay, well, thank you very, very much for your webinar presentation today. I know that I learned a tremendous amount, and I'm sure that those who participated did the same. So thank you again, Becky. This will conclude our webinar. We'd like to thank everyone for joining us today. Please be reminded that Wisconsin Facets has over 100 scheduled trainings and webinars for the year 2021. Please check out our website calendar and register for any of the upcoming trainings that may be of interest to you. And also please watch for the short evaluation that will be coming your way after today's live presentation. Again, thank you, Becky, and thank you all for joining us today. Be well,
Thank you.
everybody. Thank you. Bye-bye.